Well, I would say first psychedelics needs to be approved before they can consider the implications of these trials. Look, what we really are showing here is that in terms of core depressive symptom reductions, there is no difference between these two treatments. But it does not mean that psychedelics are not useful. They, of course, have a different side effects profile. They have different pros and cons. So I think, at the end of the day, both patients and doctors are going to be better off when psychedelics are going to be a legal treatment option. It's basically just one more tool that the clinician can use to treat their patients. So the paper just came out yesterday, so I'm not exactly sure what influence it is going to have. But I would say that, early psychedelic research, in the current wave, it really disregarded this issue of functional unmasking. And it really became a hot topic in the summer of 2024 when, as you probably know, the FDA rejected MDMA-assisted psychotherapy for the treatment of PTSD. And this was one of the issues. And I think, this paper is just going to add more fuel to that debate that these effects do matter when we are evaluating a new drug. And here we are showing you a way of how to deal with this issue. Basically, everybody is trying to find an active placebo that can effectively blind psychedelics, but so far nobody has succeeded. And actually, nobody has even came close to it. But with this meta-analytic approach, we are sort of taking the opposite end of that. You can also make a fair comparison if in the comparator arm, you are allowing the same biases to be unleashed. I think, this is not just about psychedelics, but definitely a pet issue of mine is that more depression studies should also collect functional improvement data. So things just like daily functioning, well-being, type of outcomes that are typically not included in depression studies. Psychedelic studies started to collect such data because from anecdotal evidence, there are indications that psychedelics improve in those domains as well. But the issue is that because they are not there with the traditional antidepressants trial, we just have no basis of comparison. So some sort of broadening what we are measuring in the depression trials beyond just core depressive symptomology, I think would help us to do analysis like this one and do it in a more in a broader sense to focus on more outcomes, not just on these core depressive symptoms. So I would say that, the critical question here is that how we are going to transition from psychedelics in the lab versus psychedelics in the real world. It always struck me as something weird that we are putting millions and billions of dollars into clinical research, but then very often how these medicines are used in real life has nothing to do with how we have tested them in clinical research. So for example, with SSRIs, 90% of the trials have a primary endpoint at 8 weeks, meaning that patients are taking SSRIs for 8 weeks and then we are measuring the outcomes. But of course, that is widely unrepresentative of how traditional antidepressants are used in real life, where patients are often taking these drugs for months and years. With psychedelics, because there is the therapy component, I expect this gap to be even wider than in the case of psychedelic-assisted, than in the case of traditional antidepressants. So I think, right now there is enough clinical trial data where I think, psychedelics are FDA approvable. But the real question is that how the efficacy is going to look like once it is practiced in real life, not in the highly constrained clinical research environment.